Hello, I'm Angel Sevilla, and I'm going to be doing my midterm physical exam on my mother here. So first we're going to assess the general survey. So I'm going to be looking at the stature, her motor activity, her gait, body, breath, or if possible, body or breath odors, her dress, grooming and hygiene, when she's talking to me, the speech, her mood and manner, facial expressions and eye contact, and any signs of distress like physical, psychological, emotional, or spiritual, and everything upon general survey looks normal to me. Next, I'm going to be inspecting the skin, and I'm going to also just be doing this throughout the exam, like the color, looking for areas of hyperpigmentation, looking at moisture, temperature, turgor, edema, integrity, lesions, or vascularization. I'm going to be first inspecting the head. I'm going to also palpate the cranium for the size, the shape, and the symmetry, which is normal. And then I'm also going to be inspecting and palpating the hair, the distribution of her hair and the texture, and also inspecting the scalp for any rashes, lesions, or any signs of infestations, which I do not know upon assessment. Next, I'm going to be assessing the cranial nerve 7, the facial nerve. So inspecting the symmetry of the face at rest and with movement of all 7 motions. So I'm going to have you smile, and I'm going to have you show your upper and lower teeth, and I'm going to have you frown, and then puff your cheeks, and then raise your eyebrows, and then squint your eyes, squeeze your eyes shut. Okay, thank you. Next, I'm going to assess cranial nerve 3, which are the lateral jaw movement. So open and close your mouth, and go like this. And then I'm going to have you clench your teeth. Also going to be assessing the joint here. Just clench your or open your jaw up and down, close, open. Also going to be assessing for signs of crepitus too, and assessing the masseter muscle for strength. I also was at the same time assessing the temporal mandibular joint for edema or erythema, and then again I was assessing for any snapping or clicking noted. Next, we're going to be assessing the eyes. So with the Snellen and the Rosenbaum chart, for example, with the Snellen, I would have her look about 14 feet away, and then with one eye, she would read the letters from left to right, and then again, cover the other eye, and then read the letters from left to right. And then that we would assess if she has 20/20 or 10/20 or 20/40 vision. And next, I'm going to be inspecting the external eye structures like the eyebrows. I'm going to have you just take off your glasses for me. I'm going to be inspecting the external structures of the eyebrows, the lids, the lashes, the lacrimal ducts for symmetry lesions, debris, or any edema. I'm also going to palpate the lacrimal structures if indicated or as indicated. Next, I'm going to inspect the globe, the sclera, and the conjunctiva, the bulbar, and the palpebral for color. So I'm just going to lift your eyes just a little bit. I'm going to go down here. I don't know any abnormalities, and also not looking for edema, injection, discharge, nodules. And then I'm going to be assessing the extraocular movements, so cranial nerve 3, cranial nerve 4, and cranial nerve 6. So we're going to look at the 6 cardinal fields of gaze. So I'm just going to have you follow my finger just with your eyes. Here, up, down, here, here. Okay. Next, I'm going to assess eyes for Perla. I'm going to be, with a pen light, I'll be assessing her pupillary response. And then I see that her eyes are reactive to light. And then accommodation, I'm going to have her, just with the, if I had a pen light here, I would just look at the pen light, and then I would bring it closer, and her eyes are Perla. People are equally reactive to light and accommodation. And then with the otoscope, for example, this is, I'm going to pretend I have an otoscope. I would assess all the internal structures of her eyes, like the optic disc for color, sharpness, and papilledema. And I would also be assessing for corneal light reflections and assessing for red reflex, which they should have. Next, for ears, I'm going to inspect the external structures for alignment, symmetry, deformities, lesions, and skin tags. I'm going to palpate the external structures like the preauricular and the tragus, the subtonsillar, postauricular, and like the mastoids areas for any tenderness, calor, or nodules. And then for the otoscope exam, for exam purposes, I do have an otoscope. I would assess for the external canal and inner ear, and then insert the otoscope, and I would report for any foreign bodies noted, any erythema, edema, exudate, cerumen, or masses. I will also inspect the tympanic membrane color, contour, and the cone of light. It should be at 5 to 7. The color should be generally gray, no scars or perforations noted. I would also assess auditory acuity with the acoustic test, with the whisper test, and then also Weber and Rini as indicated with a tuning fork. And then for the whisper test, she generally should be able to hear what I say. So I'll cover this ear here. And then you tell me if you hear it.
99.
Okay. Thank you. And then with the tuning fork, it would assess air conduction versus bone conduction. And then for the nose, I'm going to be assessing the frontal and the maxillary sinuses for erythema, any swelling or tenderness noted, which I don't know any. And also I'm going to be inspecting the external nose for asymmetry, lesions, or deformities, which I do not note. I'm also going to be assessing for patency and palpate for stability, tenderness, or masses, if indicated, which I don't note. And then using an otoscope with a speculum, I would inspect the nerves, the mucous membranes of color, moisture, edema, exudate, any bleeding, ulcers, polyps, septum deviation, or perforation. So, pretending I do have an otoscope, I'm going to have you just tilt your head up. I would then lift the tip of the nose and then look inside with an otoscope in the light to see. But I don't know any abnormalities. Next, I'm going to be inspecting the lips, external, and then inspect in the oral mucosa. Have you open your mouth? And then I don't see any abnormalities. Looking also for Wharton's and stents and stuff. So I'm gonna have you just lift your tongue up like this. Open your mouth like this. Okay. And then I'm gonna also assess hard and soft palate. Get the symmetry, color, tongue is midline. I also assess tonsils and pharynx color and any other abnormalities which I don't see or note. And then for the neck, I'm going to inspect for tracheal deviation, which I don't note. And then thyroid enlargement and carotid pulsation. I'm going to inspect and palpate the paracervical lymph nodes. So I'm going to do the occipital, preauricular, post-auricular, tonsillar, submandibular, submental, and also the posterior cervical chain right here. And then the anterior, which I'm going to palpate one at a time. And I don't note any enlargements of the lymph nodes. Next, I'm going to inspect the thyroid at rest and with swallowing. So I'm going to have you look this way. I'm going to displace the thyroid and I'll have you swallow. Okay, I'll have you look the other way. I'm going to displace the thyroid and I'll have you swallow. Okay, I don't note any abnormalities at all with the thyroid. I'm also going to be just inspecting for the shape and if there's any scars. I'm also going to palpate the cervical spine for symmetry and if there's any masses, edema, or tenderness noted. I'm also going to be assessing the cervical range of motion. So I'm just going to have you again flex, look down, look up, look side to side, and then ear to shoulder, and then ear to shoulder. And also I'm going to assess cranial nerve 11, which is the spinal accessory nerve. I'm just going to have you shrug your shoulders against me, okay? Ready? Okay. And cranial nerve 11 is intact. Okay, and then I am just going to have you, we're going to just move the bench. And we're going to have you sit just facing the back, with your back facing the camera. So I'm going to be inspecting the posterior thorax. So I'm going to inspect and palpate the spine for any tenderness. I'm also going to be assessing for the curvature of the spine and if there's any masses noted, which I do not see. I'm also going to be assessing the AP to transverse diameter, which should be 2 to 1. I'm also going to be assessing for her respiratory effort, her anterior and posterior lung expansion, and I'm going to be assessing, okay, and I'm also going to be percussing the chest for resonant percussion notes, and I'm going to be doing it in a lazy S pattern, comparing right to left, and generally it should be the sound should be in timpani and not dullness unless noted around the ribs. Okay, thank you. And then I would auscultate the lung fields for breath sounds, or to make sure that I'm not auscultating over the ribs, but to rather go in between them. And I'm also not going to forget to auscultate the right middle lobe. Okay, whenever you feel the stethoscope, you're just going to take a deep breath in and out. And then I'm just going to have you raise this arm a little bit and take a deep breath in and out. Okay. Thank you. And then we're going to have you just turn back around and face the camera. Thank you. We're going to be, again, assessing the anterior thorax, assessing her respiratory effort, and then also inspect the shape. Look for symmetry. I'm going to palpate for tenderness as indicated, and then I'm also going to percuss the chest for resonance as indicated, doing the lazy S pattern, and then lastly, auscultate the lung fields and the breath sounds. Percuss. Okay. And then I'm just going to auscultate. And then again, whenever you feel the stethoscope, just take a deep breath in and out. And then again, the right middle lobe. Okay. And that completes the end of my midterm exam. Thank you.